cleaning and hygiene. Now, in today's webinar, we'll be focusing on laundry, dry cleaning, and linen care industry. And this reminds me, like a few months ago, when the news of the pandemic had just about surfaced, I remember asking a couple of laundry professionals on how this whole thing will impact the laundry and dry cleaning industry. And I could tell that they really didn't have a concrete answer to give me. Now, I don't blame them because none of us at that point of time could really tell what COVID-19 would mean to all of us. And look at us now. These certainly are the most challenging times, and one cannot emphasize enough on the significance of the effective measures that should be taken while handling the linen and at the same time taking necessary precautions to deliver clean and hygienic linen to all. Now, in today's webinar, we not only want to touch upon that, but most importantly, we want to address how the industry can cope and overcome this pandemic together. Now, we have with us today a very special guest speaker who has, if I may say so, has truly dived neck deep into helping the international laundry and dry cleaning and the linen market fight this pandemic together, making him an apt choice to address the professionals here today. Welcome, Mr. Joseph Ricci, the TRSA President and CEO, and thank you for joining us today and sharing your expertise. Welcome, Mr. Joseph. I hope you can hear me.
Thank you for having me this evening. So again, thank you for joining us. My name is Joe Ricci. I'm the President and CEO of TRSA. And I'll walk through a couple of slides quickly, and then we'll get into some question and answer, just to give you a scope of kind of the industry. TRSA is we're a trade organization, and we represent about 200 laundries globally. So those are the laundry operators, and then about 130 suppliers. Those are people that supply equipment, textiles, chemicals, any of the supplies or vendors that we need in our industry. And our primary function is really advocacy and professionalization of the industry. So we spent a lot of time working on issues recently on getting us recognized as an essential service in the United States, but working on issues that impact our industry and make a positive outlook. I'll give you a little breakdown of the industry itself. So this sort of shows you a little bit about the size of the textile services market globally. We were in the midst of doing a new project with The Economist, and was supposed to be released in June at the World Textile Services Congress. But that's changed now since the economy has changed dramatically. But pre-COVID crisis, this kind of was the outlook of the industry in millions of dollars. And this comes from not only research we did with EIU, but IBIS. We also work very closely with the Europeans and the Chinese and the Australians to give you an idea of the size and scope of the industry in general around the world. And then the next slide kind of breaks it down as to where that comes from. So you see healthcare, hotels, workwear, F&B, facility services. And I do just kind of give you an idea of where the industry was pre-COVID and where we were going. So when we see healthcare, we're talking there's two different markets of healthcare. There's hospitals and long-term care, which we call acute healthcare. So those are bed linens and towels and things that you would see in a hospital or long-term care center. And then the next piece is really what we call non-acute, which is medical offices. And that'll become important when I tell you about what happened post-COVID. But those are like medical offices, outpatient surgery centers, generally organizations that are elective medicine. Hotels and hospitality, that sector there is outsourced hotels. And that really varies by where you are in the world. In Europe, the market is 80% outsourced to laundries outside of the hotel. In the United States, it's about 80% in-house. So where you are in the world really depends on how much is insourced and outsourced. And that, again, is a factor in the impact of the COVID virus. F&B restaurants, it's a smaller sector there. It's a smaller orange sector there. Again, it's important to note based on the impact of the virus. And then there are other things that our industry in North America and Europe and other countries are getting into that we call facility services. So that's soaps and antiseptics and things like that. They would paper products that they would provide. United States fire extinguisher work, first aid, and then direct sales is the last piece there. Pre-COVID, when The Economist was working with us, they were showing us where they thought growth was going to be, where the greatest opportunities would be. You see the Middle East there is one of the better opportunities, sort of Asia Pacific. Areas that were were a stable outlook, and then where they were looking for growth. There wasn't a lot of growth, but there was still a very positive attitude. We polled our members. Our members every quarter, and pre-COVID, there was 100% confidence that they would meet or exceed their expectations for the year. So we do that every quarter. We have not done a post follow-up on that particular survey, but we have been surveying our members post-COVID. I'll share some of those details. So that kind of gives you an idea of where we were, what the size of the market is, and where we were pre-COVID.
Great. I mean, before I get into the next question, I also would like to encourage all our attendees that if you have any questions during the course of our interview, do feel free to write in your questions in the chat box, and I'll definitely address them as we go ahead. And just to start off with, Mr. Joseph, so if you can shed some light on some of the kind of best practices or precautions being taken internationally while handling linen from the affected patients.
Sure. So I think, first I'd like to touch on just quickly the sudden impact of it. So you saw that we had growth there in the thing. Then you see here's where we are today from a standpoint of the virus, where it's in the world, and I sort of highlighted the Middle East hasn't seen it as much yet. Very few cases so far in that region. Had a quick drop off. This shows you the drop off in business. Initial drop-off in business here. These are the economic forecasts post-COVID. So you see that there's not a great outlook so far for what's going on. And then you see the drop-off in work. So we saw a sudden drop-off particularly in work for the hotel sector and the F&B sector, where the other sectors were seeing some positive, some continued growth there, particularly in the healthcare sector. But note that even the healthcare sector and the non-acute healthcare sector are down, and I can explain those later. But let's go into some of the best practices that we learned here. Skipping ahead, let's see. So some of the best practices that we've talked about is first of all, it's important to communicate with your customers and with your staff that the normal wash process that you're using now is ample for this COVID virus. It's a very fragile virus. Can be killed by almost any topical type of antiseptic. The normal wash formula between the heat and the chemical, the agitation quickly kills the virus. There's a lot of information you can read online about how long the virus lasts on certain substances. There's really nothing of how long it lasts on textiles. There's some hypothesis that it lasts from 3 to 6 hours. Some cases they've said longer. On hard surfaces it lasts longer. The important thing that we found is that it's not to be treated as hazardous medical waste. If you recall, during Ebola, all the medical waste, sheets, towels, pillowcases were all burned after a patient used them. That is not the case here. Some of our healthcare partners were moving this into hazardous waste, and it created some shortages because they started to burn the materials, and that was not a good sign. So we talked to them. We've now convinced them that it's not hazardous medical waste, and that's an important distinction. We also improved all of our personal protection. So if you work in the hospital environment or healthcare, in the soil sort, when you're handling the soiled linen, that you're wearing gloves, you may wear masks. You're certainly separating your soiled from your clean, and what we call universal precautions. But we found that all of our members started to do that. So everybody internationally started to use more personal protective gear, really assuming that every piece of clothing, whether it was a garment or a uniform or linen, was infected with the COVID virus. So it's important that you work with not only your production staff, but your route supervisors and your route personnel, any of the drivers that are picking up, any of the personnel within the properties you're working with to use more PPE. We saw more cleaning. So obviously more cleaning within the production, also on the truck, more emphasis on hand washing. A big piece was social distancing. So that was separating your teams, might be rotating breaks and lunches, looking at job sharing programs, making sure you're setting up perimeters on your production line so that everybody's 6 feet away from each other, so they're not transferring the disease. I mean, the one thing you want to make sure is that if you can be operational, that you are operational, and you don't want your staff to be sick or transferring it within your team. That could wipe out your whole production. And then obviously we saw a demand for cleaning supplies. So the the customers of the industry started to look for more cleaning supplies. So, and that's where they ran out of some of the things like hand sanitizer, paper products, things of that nature. So we did see an upswing in demands from customers for those products.
I mean, of course, we have a lot of.
Okay.
Do go on. Sorry.
No, I was just going to say, did you want to see that there were some of the things that were production oriented, that I can talk about some of the things that they changed from a production standpoint as well. So here's the impact.
Yes, that was my next question. In fact, what kind of operational impact have we been seeing at the laundries right now at this stage?
Sure. So as I briefly touched on, there was a big impact on volume, obviously. So as soon as we did they started to do the shelter in place or the stay at home processes and the travel restrictions, hotels and F&B or restaurants went to almost zero. They went down almost immediately to zero production, which was very, very dramatic, obviously, for them. In the workwear sector, it's down about 20%, which is uniforms and workwear. And that's going to continue to decline because it's really based on unemployment. So as the unemployment figures change globally, that workwear number will change. The non-acute, that was interesting because you would think with healthcare that it would stay stable, but it was down over 40%. And that was really due to cancellations of elective surgery. It was closing of doctors' offices. Nobody wanted to go to a doctor's office. Doctors didn't want to perform anything they didn't have to do in person. Dental facilities, outpatient surgery. So that was a huge piece as well. And then even in acute healthcare, which is the hospital locations, long-term care, they had early discharges. Again, elective surgeries were discontinued. They tried to clear the hospital to prepare for the peak. So some of the hospitals were only operating at 60%. And then when you have a COVID patient or some of these patients, in healthcare, you're turning over your room every day, which is about 18 pounds, 12 to 18 pounds of linen. With a COVID patient, you're only turning it over every 48 hours. And when you do, it's only about 6 pounds. So, you're really not making as much, there's not much turnover in volume. So there was a huge drop in volume even for the healthcare industry. So while some are suffering more in the hotels and restaurants, everybody's suffering some. And how is that suffering taking place? This is coming from our survey that we're doing every 15 days. So they had layoffs of employees, they reduced hours, some people closed plants. There's a big push right now to seek financial aid. Some tried to reduce their prices, which was a big indication. They limited certain routes, they shortened routes. There was a reduction in delivery days. They tried to do anything they could to try to save some money. And then you had some shortages. So if you see here, the big shortages were really in PPE, antiseptics, some in linen. And why was that? And I think one of the things that's coming to highlight here, and we'll get into a couple of cases, is this is a map of Europe. They use what's used in the surgical center versus reusable versus disposable products and surgical textiles. And the United States, we're about 90% disposable. Europe, if you see here, there's a lot that's very high, some that's very low. The more disposable you have, the greater your shortages were in PPE. And we're certainly seeing that here in the United States, that the surgical gowns, the isolation gowns are all really in low supply. And that's really because they were disposable products, just like the masks. So, masks have always been single use. Now they're looking at making those reusable. I think that's a good push. And I think that also offers opportunity down the road for our industry. And then this is the impact on the vendors and suppliers. So more remote work, again, reduced hours, layoffs, delayed installations, delayed orders. So, the trickle down effect to the vendor suppliers, they're feeling it as well. And depending on how you're set up and what your operation is, the more diverse you are, whether you're a supplier or a vendor, the better off you're surviving the COVID crisis right now from an operational standpoint.
Definitely. I mean, now going on to the next question, I just want to know what kind of support can laundries provide to their clients, be it hotels or the healthcare industry or even the airlines, what kind of support can they provide at this time of the crisis?
Sure. I think one of the big things that we've seen is communications. We're seeing now where hotels are now becoming centers for healthcare workers. They may be becoming centers for certain parts of the world for homeless patients. They're becoming secondary hospitals if the hospital becomes full. So if you're communicating with your hotel, for instance, you may find that they need help for other reasons in this kind of critical situation. You also want to maintain that communication because at some point they're going to reopen. Now, they may not reopen in the same vein or as fast as they were operating before, but eventually most of these restaurants and hotels will reopen, and you want to maintain that relationship because they're going to struggle to reopen. So if you think about a restaurant, it's probably going to cost them $25,000, $30,000 in new supplies to reopen. They're going to have to bring in employees. They're going to have to gear up, and they may not be able to pay you immediately. And same with hotels. So you've got to work out a relationship with them so that they're prepared to reopen, so that you're prepared to reopen. The other piece you want to talk to them about is the laundering process. Again, talking about medical waste, the importance of hand hygiene. You may want to provide them PPE if they're going to become operational. So it's really educating them on the process, the importance of reusable textiles. It may be something where if they're COG or customer-owned goods, you might want to talk to them about linen rental, which would be less expensive for them to open back up if they do a little linen rental program. So it's really mostly communications and seeing what their needs might be. It's sometimes difficult conversation. I'm talking to 20, 30 of my members a day, seeing how they're doing, checking in. Some of those conversations are very difficult because they're not operational. They don't have any employees. They don't know if they're going to reopen, but they're thankful that I'm calling them and talking to them. So I think that's the most important thing I can tell you.
And how about the suppliers? I mean, what kind of support can they provide to the service providers?
Sure, the suppliers have been great. I talked to supplier members as well, and while some of them are struggling because they don't have a very diverse base, they're really working with the industry now very closely because there are a lot of laundries that are operational, so they need help, right? They need consulting help, chemicals, they might need spare parts, but some of them may have some difficulty paying. So the suppliers and vendors and the operators are really working closely together to ensure the industry survives. And I think that's the most important element for me to emphasize there is that it's going to be a true partnership between both groups. So it's really going to be working together to see what best fits each one of their business operations and how they can help each one of them survive. Because only if both groups survive can we as an industry survive. We need, as laundries, we need all the suppliers, and we need a diverse suppliers, multiple chemical companies, multiple equipment manufacturers, multiple textile manufacturers, and we need them to partner with us. And particularly now when the supply chain is obviously a major issue with a lot of textiles made in the Asian countries in India and Pakistan, Cambodia, some of those other areas of the world, as they shut down and they run into issues. Supply chain is really critical. And the better relationship you have with your providers, the more likely you are to get the textiles that you need. We've talked to a variety of our vendors that are, they're not looking for new business. They're looking to make sure they're satisfying their current client base, and they're actually holding materials to make sure their clients are operational. So again, it's developing that relationship from both sides to help each other. And that's critical. And we've been trying to work with both our vendors and our operators to ensure that there is survival.
Sure. I mean, if you can see, we have a very interesting question that's come up from Mr. Raghu Harihar. He's written that what type of change can we expect in the future for the laundry industry with regards to a bigger pandemic event like this?
Sure. I mean, I don't think anybody can really tell you exactly what's going to happen at the end of the pandemic. It really depends on how long it lasts. We are looking. We've assigned our internal team. We have a staff of 15 here. We have about a half of our staff working on current, what we're calling tactical response. So we're talking about responses to things that are going on, making sure our guys are operational, making sure things are going on from a standpoint of they've got the information they need. From a post-COVID strategy, we think there's going to be an accelerated market trend. So if you look around the world, there's been an accelerated trend to delivery of food, to pickup of food. So we think that's going to accelerate. We think differentiation within properties of the hotel industry. Some of the trends you saw will accelerate, especially slowly as travel comes back and things like that. We think there's a lot of opportunity in what we call true sustainability. So as I mentioned earlier, with the isolation gowns and the surgical gowns being disposable, I think people are going to look at that as depletion of resources and inventories, but also because it's better for the environment not to make disposable products and end up becoming waste as well. So we think there'll be a new emphasis on that. We think there'll be new emphasis on hygiene that will continue. So whether it's cleaning products, using more PPE in the laundry, Maybe looking at table linens as a protection against infection because they're on top of the tables and the tables don't always get cleaned appropriately. Garments in the restaurant, wait staff, making sure they've got clean materials, which we think will need more rental, as people don't want to be washing these clothes, which had been a trend. We think there'll be more outsourcing from OPLs to our laundry members, just because of the issues around hygiene and cleanliness and staffing and things of those nature. So we do see some positives for the industry coming out. We think there'll be fewer players. We don't think every laundry will make it through. We think there'll be more diversity in customer base. The members that we see that are doing really well now are the ones that have a little bit of healthcare, maybe some F&B to support that, even the healthcare and hotels. So you need to have a more diverse base, facility services. So it may not keep your business operational, but even our big F&B vendors, they may be down 80% in restaurants, but they're up 20, 30% in some other sector. So it helps them survive. Diversity is really critical.
Yeah. We also got another interesting question on what do you look at, how do you look at the change in the nature of customer behavior towards laundry?
Well, customers from the what are their change of behavior on the outcome? I think they'll look to our industry to really be a source of information going forward. I think they'll be looking to our industry to provide them information about hygiene and cleanliness to support their story with their customers, right? So if you're a hotel and your customers are coming there nervous about the cleanliness of it, you're going to want some partners there that will talk about the cleanliness of the linens, the cleanliness of the textiles, as well as obviously the cleanliness of the rooms and the facilities around that, which is cleaning products. So there are things that they can turn to our industry as experts on. So I think you need to position yourself as an expert. I know we talked about training and things like that. There's a lot of training material out. Lots of organizations offer it. I know that there's information on your website, on the website of TSA, the TSA, our website, all has training material and information on cleanliness of products, the cleanliness of commercial wash versus home wash. So we think there'll be a big trend towards more commercial laundering of products and services. And that's certainly how we feel about it. And then more reliance on us as experts.
Sure. And also there's someone who has asked about for textile disinfection, what kind of process would be the best approach, especially when we're talking about retail laundries?
So when you say retail laundry, is that like a coin laundry or is that a dry cleaning?
I think it's more to do with for the commercial laundry.
Yeah. So as I said, that there's a lot of processes out there. We have we have a hygienically clean process that we talk about. It's really a combination of looking at your wash pie, your chemicals, your agitation, your water, and along your wash pie formula. So there is no set formula for this. It's obviously working with your chemical provider, whether it's Ecolab or Christian's or Washing Systems, whatever your chemical supplier might be, working with them. For this virus, we've certainly found that the normal operating washing process works just fine. There's no need necessarily to change the process itself, but you may want to look at some of those things. There are chemicals out there that do a better job of disinfecting, that do a better job of working within your operational system, depending on what you're washing. We certainly think that water obviously is a valuable resource. We have our hygienically clean certification. We've certainly found in testing, I think we've done over 5,000 tests, that while the laundry process works pretty well, there's certainly been a drive lately to use less water, less chemicals, less time. Obviously, it's greener, it's better for the environment, it's obviously less expensive. But we found that you really can't skimp in some of those areas. We've certainly found that when you drive the water levels too low, that people are not passing the hygienically clean testing process. So while you want to drive to use less water, and we think that's important for the environment and a variety of issues, but you don't want to drive it too low. And that's one of the reasons we came up with our hygienically clean process, was to look at water levels and chemical levels and making sure, even that we're trying to be environmentally conscious and drive down pricing, that we're still producing clean textiles, which is really critical.
Okay. Is there any particular recommendations or kind of chemicals that one should use?
No, and we don't recommend any particular chemical or chemical company. We recommend that you work with your local providers. 25, 30 years ago, people did their own chemical titrations and developed their own wash formulas. That is all really now relying on the chemical providers. And so I would certainly talk to multiple chemical providers to talk to them about what might be the best fit for your mix. Really has to do with your product mix, right? What are you washing? How soiled is it? Is it a very white tablecloths and linen and towels? Is it heavy soils from manufacturing or the oil fields, production facilities? Is there blood on it from a healthcare or from a food safety standpoint? So it really depends on your mix of linens. That really going to dictate your laundering process and your formulas.
I think coming back to the customer behavior question, there's someone who has asked if you could suggest some ways on how you can actually rebuild the faith in retail laundries, especially when you're catering to families or homes.
Yeah, so I think rebuilding the faith, I think that's important. Certainly here, and when we've seen internationally, there hasn't been a concern that the textiles are dirty. The textiles are creating a problem. I don't know if that's different anywhere, and I'd be interested to hear if somebody had a comment about folks that are nervous about textiles carrying the COVID virus. But I think it's how you handle the linens, and it's how you pick them up, how you deliver them. And again, educating them about your hygienically clean process, how you're processing them, how your process works, your mixture of water and chemicals, time, agitation, how those things go into your process. And some of those can be very simple. I know we've developed materials that you can hand out to your customers and to your employees. Lots of organizations and associations have done that, outline the process, the steps we take from a laundering process to make sure things are clean, to make sure that our employees are safe, that our customers are safe, whether it's limiting interactions and using PPE. Those are really the items that you want to have. And you want to create those materials so you can hand them out. I think that's the value that some associations bring to the table, is it's a third party talking about what you do. We have a certification process in the United States. The Europeans have different certifications and standards. People really look to that as a third party verification. And that's why our certification has taken off. We have over 200 plants that have a hygienically clean certification, whether it's for healthcare or food safety, and it just verifies their process. So it's both an inspection process and also a process of testing the linens. So there's a linen testing process that goes with that. And there's a variety of certifications at different levels that you can use around the world. It's nice to have a third party verification of the process. I think it makes everybody feel better about it.
Now, will there be any adverse effect, if they because of the processing of the linen coming from quarantined guests?
That's one of the concerns that we've heard, is that so these hotels that are now have quarantined guests in them there was some concern about will people come and be concerned about the linen. And again, I think it's educating. It's educating people about the processes that we use to clean the linen. Think about it from a healthcare standpoint. The linen we get every day from hospitals and long-term care facilities around the world is very dirty. It has all kinds of viruses. It might have chemicals from treating patients that are very, very ill with radioactive material. So it's very, very dirty when we get it. And our job is to clean it. And we had some members that called us right when the outbreak started and asked us if they should pick up possibly COVID contaminated linen. And we said that's what we do, right? We pick up dirty linen and we clean it and we make it hygienically clean. So it's all cleanable. It's not like Ebola. It's not like some of these other viruses that stayed in the linen for a long time and the linen had to be burned. This is a very fragile virus. We have to really look at what the virus and what the outbreaks might be. In this case, it's not something they should be concerned about. If it was Ebola, there might be more of a concern around it. So it's really education. We're working with our media. We have a media expert that we're using to communicate with the general media to talk about our processes, talk about linen shortages. So we're trying to get that message out best we can through that source out to the general public. And we haven't had a lot of concerns about that. I think we've done a pretty good job of getting that message out. People that the processes that our laundries use do clean the linen, do make them safe for human use and not passing along the germ.
And of course, there's another concern on if we use more disinfectant chemicals, could that damage the linen?
Absolutely. I mean, that's one of the things you have to balance. Again, it's working with your chemical provider. But yeah, we know that depending on the chemicals you use, you can shorten the life of the linen. It can make the linen tear more easily. It creates more lint, which creates its own problems. So you really need to make sure that you're balancing the type of product that you're using with the soil and with your chemical provider to ensure that you're not damaging the linen. Clean is clean, and you've got to come up with what that level of cleanliness is going to be that your customers will accept, that's good for your organization as an acceptable product, and use that as a balance. And there are measurements out there of, if you wanted to do testing, Europeans have got a couple testing regimens. We certainly do. That at least it gets you a baseline of what cleanliness should be.
Sure. I think Mr. Phil has quite an interesting question as well. Is there any kind of an added benefit in documenting your wash process to confirm the proper cleaning?
Absolutely. We recommend that all of our members have what we call a quality assurance manual, or a QA manual. And that manual goes through all of their processes and procedures and documents them. So not only from the washing process, but the cleaning and housekeeping of the facility, the proper handling of clean and dirty textiles, the proper handling and cleaning of the vehicles that deliver the textiles, proper procedures for those folks that are on the routes picking up and dropping off. So it's really having that documentation that you could, if you needed to, share. We also encourage people to do tours of their laundries with their customers, to take them into the laundry, to show them the processes, to show them their QA manual, to talk to them about what they do from a standpoint. I've been in the industry now 11 years. I had no idea when I came into this industry that it even existed. It's always impressive to go into these laundries and see what they look like, and the work that you guys do out there, and the level of sophistication, the level of cleanliness, the level of automation, depending on where you are in the world, and the processes that we use from a chemical and textile and treatment standpoint. I know that that's really been critical for a lot of our folks that we talk around the world, is really the tours, bringing people in to see the facility, see the operation. They're always very impressed with the laundering process, the cleaning process, how it all operates. To me, that's documentation is pretty critical, and sharing some level of that documentation with your customer. It may not be sending them your whole QA manual, but at least outlining it on your website or on some documentation you can leave behind. Doing animations, we've done a couple of animations on our website to help people understand what the laundry process looks like.
And is there kind of any standard process for quarantined linen, say picking it up in water-soluble bags, or any sort of test that you need to do?
Testing for cleanliness, is that the?
No, it kind of a standard process. Is there a kind of certain process, especially for quarantined linen?
Well, for this linen, I mean, and I think I don't want to be repetitive here, but I think, when you have certain types of problems, when you had Ebola, for instance, that was linen that was marked as hazardous waste, that was put in a red bag, and that was burned. Okay, that was a very dangerous, and it cost the industry a lot of money because we were burning textiles. But that was the global understanding of what we needed to do. So we looked to the World Health Organization, we looked to the CDC. We look to these global bodies in healthcare. They've all said that the normal laundering process for COVID-19 is your standard operating process. So you may want to take precautions about bagging linen in transport and moving it to your property. We certainly have rules in our certifications about when you bring it to a facility that it should be covered to prevent it from getting any dust or bacteria or contaminations from outside during the shipping process. But for this particular virus, and every virus is going to be different, every pandemic is going to be different based on the structure of the virus and the type of virus that it is and how widespread it is. This particular virus is treatable in your normal laundering processes. So picking it up, sorting it. Again, you want to make sure you add the extra layer of personal protection for your employees. There's been no cases of the virus being passed from linen or from sorting linen or from dirty linen to anybody catching it. It's just better that you use as much PPE as you can. One of the other recommendations is not to shake the linen, to ensure, not to shake it hard, to ensure you're not making it airborne from this particular virus. But again, it's the same standard laundering process. You don't need to use soluble bags. You don't need to separate it from your other linen. You should assume that all the linen you're receiving, all the garments, all the uniforms, are contaminated, and treat them as such when sorting, and making sure your washing process is going to clean them. But again, it's working with your chemical providers to provide the best chemical solution and wash formulas for them.
Of course, now we have touched upon the kind of best practices, the precautions one need to take, and the impact that we've seen internationally regarding the pandemic. Now, moving on, Mr. Joe, we need to talk about the kind of alternate revenue opportunities for laundries now. if you can shed some light on that.
Sure. So talk a little bit about alternative revenues. We talked a little bit about these already. So cleaning supplies and antiseptics and soaps. We think that's right now. That's something you can jump into right away. There are people looking for those items. Paper products, particularly as disposables are becoming short. Looking at those items. Direct sales. So if you can get your hands on masks and PPE, we had folks call us and tell us that certain parts of the hospital were calling them directly, trying to buy PPE. Not through the normal purchasing process, but through a direct sale to their particular part of the hospital. So there is a big demand for that. If you can, masks and other PPE, gloves, things of that nature, there is a big demand for that, and it's a direct sale. Assisting other laundries. So we've had some laundries that when there was too much work for a particular healthcare laundry, with the laundries that were doing processing hotel laundry, jumped in and helped them out, obviously sharing formulas and sharing best practices for sorting and PPE, replacing OPL of laundry. So hotels might be operational, but maybe they're only running at a 10, 12, 14% occupancy level. They may not want to run their laundry 1 or 2 days a week. They may not have the people to run their laundry 1 or 2 days a week. So you can go to these hotels and say, look, you're running really low. Let us take over some of your workload until you get full again. They can rerun your laundry if you want to. They may decide to continue to outsource it. Again, hotels are housing medical personnel and patients, so working with them. And then we've had a lot of call from government laundries, particularly in Europe and the United States, looking for coverage over different facilities. So it could be emergency hospital locations. In New York City, they're using the convention center as a medical facility, and they're also using some tents in Central Park, where one of our members is doing all their linen. So you never know when these come up. So it's really developing a relationship with your local government on those things. We're doing homeless camps, shelters, prison laundry, where they don't want the prisoners to be exposed to, from a liability standpoint, being exposed to potentially contaminated linen. So they're outsourcing it to commercial laundries. So some of it's laundering process, some of it's really the facility services piece, which has been a huge growth. Certainly in North America, with our largest companies, Cintas and UniFirst, nearly 20% of their revenue comes from facility services. So it's deliveries of soaps, hand sanitizers, paper products, restroom facilities, air fresheners. It's really relieving some of those duties that might be done by a cleaning crew. And in some cases, they're actually doing the cleaning themselves. They're actually serve as a janitorial services standpoint. And that's been a big difference. If you look at I'll take, for example, the Cintas, which is the largest company in the United States. They're about an $8 billion operator in the United States. They also operate in China and a few other locations, but primarily in the U.S. and North America. In 2008, 2009, they took a tremendous hit because they basically were just in the uniform business. And their stock was very significantly hit and their revenues were significantly damaged. And since then, they've taken on, they're doing scrubs for hospitals. They're doing reusable scrub dispensers, or retail medical, or what we call the non-acute medical work. They started to do fire extinguisher checking, first aid, a lot of facility services. And so they're going to be impacted by this downturn, but they're certainly insulated. So I think that's the other piece, is making sure you're looking for a diverse market. So whatever your primary market is now, and looking at these alternative revenue streams, not only things that you can sell that are outside of kind of your normal scope, but what are markets that you could serve with a laundry service? And somebody mentioned doing home laundry. I mean, that's a complicated process, tracking and keeping track of personal items, depending on the type of laundry. We've seen a big growth in long-term care facilities, both in Europe and the United States, where you've got an aging population. They're more and more staying in these long-term care or nursing home or whatever kind of facilities you want to call them. And they've got laundries, but they don't operate very well. And there's a lot of liability now with cases breaking out in these facilities, but we think that's a big opportunity for outsourcing. And we did a lot of research there last year and found that was a big market growth area for us. So we're seeing that as a growth area, certainly in North America and Europe.
Could you also touch upon certain training methodologies that one can approach during this time?
Sure. I think it's always hard to train people in this environment. In the laundry, when typically they're in production and you've got your breaks and your lunch, and then then you lose your employees. They go back home and they come back the next day, and you're mostly focused on production. So we've been doing a lot of web-based training. So We've got, I think on our website alone, we have 200 educational programs varying in length. We've got a hygienically clean program on our website that I think is very inexpensive to use for training, but it's all mostly virtual now, mostly online type of training people that they can do on their own time, on demand. So they can do it in a 15-minute break. They can do it at home. We've tied certificates to the education. We're seeing that in Europe as well. So that you can they go through the process, they pass the test, they receive a certificate, they can use that to maybe make a little more money, to move up from production line to supervisor position, from a supervisor to manager. So we're seeing a lot more training done in smaller chunks. So a lot of the training now is 10 minutes, 10-minute chunks, maybe 5 or 6 segments in 10-minute intervals. We've got on our website production videos. We have 4 different sets of production videos, 6 videos apiece, that walk you from soil sort to pack out in each market sector. So they walk you through the process with best management tips and safety tips. Each video is about 1.5 minutes to 2 minutes. So it's got less than 15 minutes. You've walked through the entire process. So really for new people, that's really good. So it really depends on where they are in the scale. So if it's production, moving up to supervisors and executives, you need to be looking for different levels of training. And again, most of it's now available online through a variety of associations. So, not only our group, but ETSA and all the national associations across Europe have information that you can use, training information that you can use. The thing that we found, and I work very closely with the national associations in Europe and Australia and China, is that we all speak different languages. We all use have different cultures, but the washing process is pretty much the same. The machines are the same, the chemicals are the same, the textiles are the same, the soils are pretty much the same. So the more and more that we start to work together, we found that we've been able to produce education and training a lot less expensively, a lot more globally, using kind of these online tools that use less words and more images because of the multiple languages that we're dealing with.
Do you feel that the industry will now look at the way they approach, the way they work? Do you think that would change post pandemic?
Yeah, I mean, again, in processing, not so much the actual laundering process, but in the handling of the linen, I think that will change dramatically. I think you'll see, how the route drivers pick up and drop off. I think you'll see them in more personal protective gear, maybe not masks, but certainly gloves, and using more antiseptic. You'll see more bagging. I think one of the things that people had gotten away from is bagging linen. They were just carrying the linen out, especially uniforms. I think you're going to see more bagging to protect the drivers and protect the customers. I think certainly in the production facility, you're going to see more PPE as well and more cleaning. One of the things that we noted, we do a lot of testing within plants, and we noticed that while they're doing a good job of cleaning the floor, sometimes they're not cleaning all the surfaces. So we're emphasizing conveyor cleaning of surfaces where they're looking at linen and where the folding machines come out, any kind of hard surfaces. I think we're gonna see cleaning of that. I think that will change things. And again, we talked a little bit about the opportunities with reusable textiles. We think that ultimately this will be a positive for reusable textiles as the industry comes back. But again, it's how we approach it and how we educate our customers about cleanliness and demonstrate that cleanliness, I think would be really critical.
I think that's very true. And on a positive note, we must believe that this pandemic will come to an end. And when it does, what kind of opportunities do you think there is for the industry to expand post this crisis?
Sure. Again, I think we talked a little bit about that. We talked about some of the accelerated market trends. Yeah. We talked about some of the things that looking at the industries that are going to be hard hit. Certainly, hospitality and tourism, retail, transportation, energy. Those are going to take a lot longer to come back. So, as people adjust to the new post-COVID environment, which we don't know exactly what that business environment will be and how long it will last, those will be slow to come back. There'll always be people that are very eager to travel and very eager to go out to eat, but there'll be others that will be very hesitant to do that. But industries like e-commerce, again, will be digital. So delivery is going to be critical. How do we adopt to delivery? There are things that we can provide to make sure that delivery people are wearing clean uniforms and using reusable textiles in some environment. There's also delivery service. So you're going to see a lot more digital kind of environment. Is that something that we can adapt to as an industry? If we're doing personal items, what becomes the impact of being able to maybe deliver personal items via delivery services. That's an option. Now we're going to see obviously growth in healthcare and in long-term care, as we talked about. We think those will be growth markets across the world as those things change an awful lot. And we think there'll be a renewed emphasis on hygiene and sustainability. We think those will be big pieces coming out of this. Will be the focus on cleanliness and hygiene, which may change habits. We're hoping that it change habits for particularly for restaurants, which we saw more and more using tabletops, more and more not having their chef coats cleaned professionally, not having their employees' uniforms cleaned professionally. They were giving them a black shirt and having them go home and wash it themselves. We think that will change as customers kind of demand that, looking at the cleanliness of the facility itself. So there may be options with, branching into more facility service, janitorial type services, really looking at, what can you provide your customer base and talking to them about these issues, about cleanliness, about hygiene, about sustainability, and then providing them with the products and services they want. You may find in your particular region of the world that it's different than somewhere else. But that's, again, why communications is so vital with your customer base. There may be things that you can provide that you're not thinking of. It's getting outside of the box a little bit. And we have companies here that, I jokingly say every time I go, I've visited almost 400 different laundry companies in the last 11 years. And only 2 companies didn't take me in to see their laundry. They consider them business solutions organizations. And they showed me direct sale. They showed me that they were, providing paper products. They showed me all the things they were doing except for the laundry. And I think those companies, they think of themselves as a service provider, not a laundry. And I think those are the companies that ultimately will be the most successful.
True. You were speaking about delivery, and there's been a little interesting question from Mr. Shiv Shankar, who has asked, how do we guarantee virus-free linen at the time of delivery? Like, how do we deliver the linen? Any special packaging? What kind of things to keep in mind?
Sure. Well, a lot of people have been, wrapping it in plastic as it leaves the plant. I think there's some downside to that. Obviously, environmentally, single-use plastics are on the downturn globally. Sometimes if you seal the plastic, we found that sealing the plastic on linen products going to healthcare can create problems because it's sealing in moisture. It's not bone dry when it comes off an ironer. We need to leave a little moisture in there to make it work. So sealing it is not good. Covering it certainly is important to protect it when it's outside. So really depending on where you're delivering it. So for healthcare, any cart should be covered. When they're moved before they leave the plant, they get inside the customer facility, they should be completely covered going in and out. Same with garments. So right now we're using plastics. I think obviously we're going to have to find an alternative to plastic covers. As single-use plastics go away, I don't know what that is yet. I think we have to be careful sometimes when we eliminate one item for environmental issues, which I think are obviously the environment is critical. We've got to be careful that we're not creating another scenario that's worse, right? So if you eliminate single-use plastics, how are you going to protect these garments? What is the best way to do that? So obviously sealing them in plastic or covering them in plastic is really the best route when delivering.
I think we have a lot of questions regarding small and medium-based laundries. How do they tackle the issue of COVID-19, especially when customers are reluctant to give their fabrics, or even when it comes to the cost of PPE, how can they bear this cost? So these are certain issues that a couple of our attendees have raised.
Sure. So it really depends on the size of the organization. So, globally, most laundries are very small. So if you look at the number of laundries there are in the world, Germany has 800 laundries, or 800 laundry facilities. About half of those are dry cleaners and half of those are laundry. So they're very small, regional domestic laundries. We have 1,000 laundries in the United States, and 2/3 of those are very small, family-owned and operated laundries. So there's still a lot of family-owned and operated laundries around, but they do have to operate in the same type of processes that the larger laundries, use from chemical formats and from personal protective equipment. There's not something you can, because you're a smaller laundry, obviously, eliminate processes that we think are critical to cleaning. So from personal protective, the things that we're talking about, like gloves, the latex disposable gloves, they're not expensive. Hand sanitizer is not expensive. You can't afford hand sanitizer. Washing your hands is actually better with soap. So just basic hygiene within the plant is critical. Cleaning the plant every day, maybe multiple times a day, is critical regardless of the size of the plant. And again, it's education. So, it could be signage. If it's someplace where they're bringing laundry in and your customers come into your facility, I think signage about how you process your textiles and the cleanliness and the approaches that you're using, looking at, again, going back to the third-party verifications. You don't have to go and get the certification if it's too expensive for a small laundry, but you can certainly look at the processes they use and talk about how you work to the processes that the larger laundries use, and document those, and again talk about those from an educational or communication standpoint.
Sure. Before I get into the next question, just like to remind the attendees that we do have another 5 minutes left. So do put in your questions. We'll try and take in as many questions as we can. So Mr. Joseph, moving on, do you have any thoughts or advice for the Middle East market? We have a lot of attendees from the Indian market as well. So if you have any advice or any thoughts for them during this time.
Well, I think one of the things that you and I talked about was there's right now heavy emphasis, obviously, in the markets in the Middle East on tourism, right? So you're doing a lot of airlines, you're doing a lot of hotels. There's certainly some healthcare. I think it's trying to diversify that base as much as possible, because obviously when tourism gets hit, that's going to be critical in the Middle East as this. Hopefully the virus doesn't impact you like it's done in other parts of the world. But as you take these precautions and begin to see less transportation, less tourism, how can you expand that service into other areas within your community where you can service customers that are not in those sectors? So it's going to take a little bit of work. It's going to take looking at other parts of the world and what they're doing. I think I would look at what the Europeans, they've got a very established market there. They do a lot of personal items. They do a lot of, again, small properties. They're looking at other ways to diversify their space there. Looking at the facility services piece, I'm not sure how much facility services is done in the Middle East, but it's certainly a piece that has been very well received in North America, and has earned 20% of the revenues from some of these larger companies come from these type of services that everybody needs to have, right? Checking your fire extinguishers, looking at your first aid, things that can be done, that have to be done, that takes away from you having to do it, from your customer having to do it and having to employ people. And I think a lot of it has to do with pay scales and how much it is to retain an employee. The more expensive employees become, the more likely people are to outsource some of these types of services that you can then take on. So again, thinking about yourself as a service provider and not a laundry is critical. Direct sales has been a big piece. So companies may not need a laundry, but they want to buy commercial gear that has their logo on it, right? So you can sell them logo shirts, t-shirts, polo shirts. There's more of a fashion now to workwear. So people may not want to have their workwear washed commercially, but they may want to buy the products. That's been a big boon for all of our companies, where they're doing their own direct sale promotional items. The companies want to have promotional items to use for their customers and to give to their employees. So I think that's another area where you can look at diversifying your market space. But it's all about diversity and diversifying your customers and your markets. I think that's the most critical piece. And as I learn more about the Middle Eastern market, I'll be able to provide more detail about it. But I think that to me is the biggest piece, is looking at how you diversify out of just tourism and get into construction work, get more into other parts of the community there that aren't just tied to tourism.
That's quite interesting. Thank you, Mr. Joseph. And there are a couple of questions regarding whether you will be starting any certification programs out here in the UAE or in the Middle East, or is there anything?
Sure. I mean, our certification is global. We have our certification, our hygienically clean certification, which is for healthcare and food safety, as well as food service, and for hotels, is available on our website. It's hygienicallyclean.org, and you can look at that, and has all the standards are posted there. We will do inspections and testing anywhere in the world. We have several facilities in Europe that have our hygienically clean and our clean green certifications. We have Canada, Mexico. Got a couple in South America that are pursuing it now, certainly in the Caribbean. So we will send inspectors to you or work with local inspectors there to educate them and get them up to speed. The process is really documentation, as we talked about, having a QA manual and documenting your processes. There's an inspection process, and there's a testing process. So the testing process is sending linens to a lab, and they have to pass a certain CFU, 20 CFUs per square decimeter based on the healthcare standard, and 50 for hotels, and it really measures the cleanliness of the linen. And we do that on a quarterly basis, so it's continuing to maintain those levels of testing, and so we do those globally. Those are global certifications.
Great, thank you so much. And on that note, I would really like to thank you, Mr. Joseph, for taking time out for us. And it certainly was an informative session for all of us. I've tried to incorporate as many questions as possible. But most importantly, I would also like to take this opportunity to thank and salute to all of you laundry heroes out there, who are still working under these circumstances and providing your support to provide hygienic linen. And let's remember that there is a light at the end of this tunnel, and we will come out of this stronger. Now, the webinar will be up on the Clean Middle East YouTube channel. Do follow us on our social media pages to get regular updates. And of course, you can get in touch with us if you would want to work together to get in more information out there in the market. So until then, let's all work towards breaking this curve. So stay safe. Thank you again.
Thank you so much for having me. I appreciate it. Thank you.
Thank you.